Hair loss can be devastating to a person for many reasons, especially if it's happening for a woman.
Now, there are a number of treatments, from creams to surgery, but one local woman is finding hope in a fairly new procedure. And just as a disclaimer, some of the images may be hard to watch. Hair can reveal a lot about a person, everything from the texture, length, style, and color, and it can be traumatic when the hair we generally take for granted suddenly starts to disappear.
It was devastating.
It's been an emotional few years for Jamie Crum.
I've been noticing my hair was just getting thinner and thinner, and I noticed my ponytails weren't as thick as they used to be. Also, I was seeing a lot more scalp than I was used to seeing, so I definitely know that there was some hair loss going on.
A harsh reality for a woman in her 30s whose gradual hair loss really started affecting her confidence.
I think a lot of it is just genetics. I have a family history of just women in my family with very thin hair. So also I was experiencing a lot of stress at the time when I was really noticing the hair loss. So I think it was a combination of all of those factors.
It was getting harder to ignore, but Jamie figured it was something she had to live with until she reached a pivotal moment.
I had a photo shoot, and when I got the headshots back, I was in shock.
With a number of treatment options for those experiencing hair loss, ranging from medications like Rogaine to hair replacement surgery, Jamie did some research and eventually opted for a non-surgical, more natural route.
So PRP, platelet-rich plasma, there's a lot of medical uses for PRP. You can do facial aesthetics with it, you can do joint injections with it, and then you can actually do hair restoration with it too as well.
Dr. David Rosner, owner of Remedy Hair Restoration and Medical Spa in Grand Rapids, specializes in this unique therapy.
So it starts with a simple blood draw, and then we have a specialized centrifuge which actually concentrates the platelets. And also you got to be careful where you go because every device is not equal. The device that we have has the highest concentration of platelets on the market. It's reliable, it's consistent, so we know the type of results that we're going to be expecting for our patients.
Jamie recently allowed us to sit in on her second appointment and is already feeling hopeful.
So it's been about 6 weeks since my first treatment, and already I'm noticing some new growth coming in, some sprouts, and just the overall difference in texture and density.
And I can confidently tell you that pretty much a majority of my patients actually start seeing results after the first treatment. The density and the diameter is something that's really important to people, and that's what PRP is able to design to do.
Dr. Rosner says some patients might have some swelling a few days after the treatment, but it's usually tolerated really well. Plus, there's no downtime, with patients able to go back to work soon after.
One of the nice things about PRP is that we're not injecting anything foreign into the body. We're just concentrating the platelets, from the patient. So it's their own blood. We're just concentrating in a certain way that actually has a lot of good growth factors. So there's no risk of rejection at all. It's not stem cells, so it's completely autologous to the patient. And patients really like that.
For Jamie, the shame she once experienced with her hair loss now replaced with optimism and encouragement for anyone else dealing with the same issue.
I want people to know, and especially females, that they're not alone if they're experiencing hair loss. And it's not just a thing that men experience, that women also experience hair loss. And I want them to know that there's things that they can do to reverse the hair loss and prevent future hair loss and get some of the confidence that they lost back. It's definitely working, and I'm getting some of my confidence back.